Breast reduction surgery and breastfeeding. After undergoing breast reduction surgery, will you still be able to breastfeed your child? This is a question I get every time I consult with someone about breast reduction surgery. Do different surgical techniques have an effect? Do the types of incisions matter? And does the amount of breast tissue removed, whether more or less, have an impact? Today we have the answers. Hello and welcome to Dr.Pornthep Pungrusmi, a plastic surgeon from the BeContour team, specialist in breast and body contouring surgery with the channel Kuikabumsali by BeContour. In this video, we will discuss whether you can still breastfeed after breast reduction surgery and what factors can affect breastfeeding. Before we get started, don't forget to hit subscribe, like, share and ring the bell so you won't miss out on great informative clips from the BeContour plastic surgery team. We already know that breast reduction surgery improves quality of life as it helps reduce back, neck, shoulder and upper back pain. It also boosts confidence in social situations. Most patients, about 85 to 95%, are satisfied with the surgical results. However, one topic that many people are interested in, and a question I get almost every time a patient comes in for a breast reduction consultation, is whether they will still be able to breastfeed after breast reduction surgery. This is especially true for women of reproductive age or teenagers whose mothers bring them in for surgery. There is a recent study by Dr. V.C. Nemeth in 2025 in the United States which found that 55% of patients who had undergone breast reduction surgery were able to successfully breastfeed. When compared with other studies, it was found that the success rate of breastfeeding after breast reduction surgery ranges from about 52 to 65%. And when compared to women who breastfeed without ever having undergone breast reduction surgery, the success rate is quite similar, at around 60 to 70%. Another interesting topic for plastic surgeons is whether the pedicle of the nipple and areola affects the success of breastfeeding after breast reduction surgery. If you remember, I previously talked about the pedicle of the nipple and areola in the video about what you need to know before breast reduction surgery to prevent nipple necrosis. However, studies have found that the success of breastfeeding after breast reduction surgery is not related to whether the nipple and areola pedicle comes from the lower side, the upper side, or the center. In fact, there have been many studies on breast reduction surgery and breastfeeding, but I would like to highlight two important studies as examples. The first study was conducted as far back as 2007 and found that after breast reduction surgery, the success rate of breastfeeding was between 57 to 65%. Additionally, the type of nipple pedicle used did not affect breastfeeding outcomes. Another study, which was a meta-analysis conducted in 2023, was a large-scale study that reviewed and combined data from 33 previous studies. There were approximately 1,535 patients in total, which is quite a large number. It was found that 62% of women who had undergone breast reduction surgery were successful in breastfeeding, and that those with the pedicle located at the upper part had a breastfeeding success rate of 59%. If the pedicle is located at the lower part, the success rate is 64%. If the pedicle is at the side, the success rate is 75%. And if the pedicle is in the vertical axis, both upper and lower, the success rate is actually lower, at 43%. And if the pedicle is in the center, the success rate for breastfeeding is almost 100%. However, there are still very few studies on the central pedicle. So the paper concluded that the position of the nipple and areola pedicle does not have a clear effect on breastfeeding. What is important is to preserve the breast tissue underneath the nipple and areola so that milk can flow out. Another interesting topic is whether the amount of breast tissue removed during breast reduction surgery affects breastfeeding. Studies have found that the amount of breast tissue removed does not have a clear impact on the success of breastfeeding at all. Another point is that there are no studies showing whether the type of incision used in breast reduction surgery affects breastfeeding. This is because the incisions in breast reduction surgery are made to remove excess skin, which is on the outside. They do not interfere with the breast tissue or milk ducts at all. Therefore, it does not affect milk production. Whether you have an inverted T incision, a vertical lollipop incision, or even a periareolar donut lift, none of these surgical techniques will affect your ability to breastfeed later on. After reviewing many studies from the past to the present, it has been found that after breast reduction surgery, about 60% of women are still able to successfully breastfeed regardless of the position of the nipple and areola. No matter how much breast tissue is removed, it is important to leave enough tissue beneath the nipple and areola to allow milk to flow out. In addition, the surgical scars from breast reduction do not affect the success of breastfeeding. If you have problems with large breasts at any age, you can consult a plastic surgeon. For anyone looking for information or knowledge about plastic surgery, breast augmentation, or breast lift procedures, breast reduction, breast correction, tummy tuck, arm lift, thigh lift, or liposuction, don't forget to hit subscribe, like, and ring the bell so you won't miss out on great knowledge clips from the BeContour Plastic Surgery team. Please also follow the BeContour Plastic Surgery page by Dr.Pornthep Pungrusmi and visit the website BeContour.com. If you have any questions, feel free to comment. Goodbye.